Hello, happy October 1st and happy fall to you. Thank you for joining us for the SRNA virtual conference. I would like to open today's session by acknowledging the members, partners, and members of the public that are joining us today on Treaty 2, 4, 5, 6, 8, and 10 territories and the homeland of the Métis. I acknowledge the strength, resilience, and capacity of all First Nations people and remind us that we are all treaty people. My name is Fred Entz. I'm a registered nurse, and I'm your council member at large for Region 1. I'm pleased to be joined by Marilyn Barlow, registered nurse, and council member at large for Region 4 to welcome you to this session and to provide some valuable information as we move ahead. Before we start, I'd just like to thank our presenting sponsor, Mailer Thomson, for their ongoing support. Their financial contribution made it possible to bring this virtual conference to our members, the public, and our partners completely for free. Thank you.
Yesterday, we began our dive into the 3 different pillars of registered nursing. In the first of these 3-part sessions, Tracy Zambori, RN, and president of the Saskatchewan Union of Nurses, shared with us the role of the union and how the union acts on behalf of the nurses. If you did not have a chance to tune in live, the session was recorded and is available for playback for the next 30 days, right here on this platform. Today we welcome Mary Smith, RN, and Executive Director of the Association of Regulated Nurses of Manitoba. She will inform participants of how the Professional Association acts on behalf of nursing to advance the profession and influence health and social policy.
You can take part by switching to the Engage tab in the session. Toggling to this tab will take you to a screen that allows you to input any comments or questions that you have for the speaker. Mary will have the chance to respond to these questions on Friday. Mary will also be asking you a few questions throughout her presentation, and you can answer these questions using the poll function, also found within the Engage tab.
Thank you for joining us today. We are proud to introduce Mary Smith, now to share the work of the association, her experience in the creation of a separate association in Manitoba, and the importance of the association within these 3 pillars.
Hi everyone, I'm Mary Smith and I really appreciate this opportunity to share the association's journey and the valuable lessons learned during the separation of regulatory and association mandates. When I was reflecting upon how I would structure this presentation, I thought back to 6 years ago when the idea of a provincial association was being discussed in Manitoba, and asked myself, what did I want to know at the time? So I'm banking on that fact that many of you are possibly wondering the same thing. So I have 3 questions I hope to answer for you. The first is to help clarify who we are and how we're different from the college and the union. Secondly, to highlight the various processes and activities we do to advance the nursing profession. And thirdly, to reinforce the value of professional associations and encourage you to support the foundational work that needs to happen if you want to have a provincial association presence in Saskatchewan. But before we get going, I'd like to add an interactive component to our time together by adding some polling questions, and we'll discuss those answers during the Q&A. So to test it out, here's the first poll that will show up on your screen. It's easy and anonymous. Just pick your answers and click submit. So the first poll is, how many years of practice do you have as a nurse? And all you have to do is choose one. This is a slide that I share at the start of all of my presentations to students as well as practicing nurses, as there is still confusion about the roles or the differences between the association, the college, and the union. I believe that the profession of nursing is directly impacted and influenced by these 4 groups. Sometimes this is depicted in a pillar formation, but I really like the concentric circles because there is indeed overlap in dealing with common priorities, such as safe, quality practice environments. But what's different is how the 4 groups address those priorities. I've added the educational institutions as a 4th pillar, or Circle, as they play a significant role in establishing the future nursing workforce with curriculums that are based on standards established by the colleges. And as you're aware, the mandate of the college is to protect the public through quality nursing regulation. The union exists to protect the rights of the nurses in the workplace, and the association exists to provide that professional voice for nurses to advance the nursing profession and influence healthy public policy. During the opening panel presentation, Catherine Stansfield, the CEO of the College of Registered Nurses in Manitoba, and I shared how the association came to be. So just to recap, with the introduction of the Regulated Health Professions Act, the college's role was now purely regulatory and therefore could no longer do any association type functions, including collecting fees on behalf of our national association, CNA. The college notified nurses about its changing role, which led to a grassroots response from a group of dedicated nurses that included Dr. Claire Betker, our CNA's past president. This group of volunteers developed the Manitoba RN Network, which had representatives from practice, education, leadership, and policy to explore the development of a new organization that could be the professional voice of nurses and the jurisdictional member for CNA. The association officially launched in January of 2016, just 4 years ago, as a voluntary professional association. Our mission is to be that professional voice of nurses in Manitoba, to support nurses to be empowered health leaders across all settings, to advance nursing and advocate for the public they serve, all while promoting and celebrating excellence in nursing. Then drilling down from that, our vision is advancing the nursing profession and public policy as leaders in health. I'm very excited about how our board reframed the values into distinct statements that clearly illustrate what guides our work. We are here for members. We foster pride in our profession. We are honest and ethical in everything we do. We find creative ways to accomplish big goals, and together we can achieve more. The association's strategic goals developed by the board are critical to our operations as they drive our priority setting, our resource allocation, capability requirements, and budgeting activities. These three goals guide our work, so whatever we do, it's meant to inspire and promote excellence and innovation in nursing practice, elevate the nursing profession and promote nurses as leaders in healthcare, and be a sustainable association for nurses in Manitoba. As the executive director, these goals are always top of mind. It's how I categorize my reports to the board and how we evaluate what we do. I also use them as part of my 30-second elevator speech when I have an opportunity to speak to key stakeholders or government officials. Membership in the association provides 3 memberships for registered nurses and nurse practitioners. Our members who are licensed practical nurses and registered psychiatric nurses receive the 2 memberships, ourselves and CNA, as they currently access liability protection through their respective colleges. This bundled membership provides many benefits both professionally and personally, and strengthens our ability to advance the profession and influence health and social policy. Now here's our second poll. What I'm going to do is ask you if I've explained our role clearly enough, because having a clear understanding of the distinction between the various groups will serve you well as you go forward during this transition period. So the poll is, what is the association's mandate? And it's a multiple choice. Choose all that you believe apply to the mandate of the association. The options are to protect the public, to negotiate contracts with employers, to advocate for the nursing profession, to develop entry-level competencies, to promote the professional voice of nursing, or promote nursing excellence. So choose all that apply that you think is the association's mandate. Okay, it's time for you to answer the poll questions. And they're going to be up on your screen here, and we will just take some time for you to go through those, and I look forward to further discussion. So to operationalize that mandate we have and the strategic goals, we focus on these 4 areas. Being that professional voice to advocate for and promote the profession of nursing wherever we can, such as meetings with the Minister of Health, the other provincial groups, anywhere we can sit at decision-making tables, we try to get there. Initially, we found we were the ones knocking on doors, but now after our 4 years of developing the groundwork as a credible organization, we are now being invited to those tables because they see us as that overarching high-level view of the nursing profession. Advocacy is a critical component of the work that we do, advocating on issues that impact nursing and the health of the population we serve in Manitoba. Our role regarding advocacy is to advance the profession and also promote that value of nurses by informing the public and key stakeholders. Working with the key stakeholders to influence social and public policy is so important to promote social justice for those structurally and socially disadvantaged. We also provide opportunities for nurses to increase their knowledge and their skills through professional development, events, and resources to assist them in meeting their ongoing learning needs and continuing competency requirements. And last but not least, celebrating and showcasing nursing excellence through student and professional nursing awards, along with supporting our nursing specialty groups. Advocating for the profession is a key component of the work of the association. When we first started, we referred to the WHO's definition of advocacy, as well as looking at other professional associations and how they did their work, as well relied heavily on the work of our national organization, CNA, as a guide as well. We developed an advocacy toolkit that assisted our members to understand the various roles and steps that are necessary in advocating. So being young, right at the very beginning, we looked at those low-profile activities such as developing relationships with government and key stakeholders, and the important component of gathering evidence to share information with those key stakeholders in government. It was very important that we didn't go out with just opinion or conjecture or what some of the members are saying, but really the members' stories were very important, but we had to back that up with evidence. Then further on, we've gone into the medium profile where we're having regular meetings with elected officials from the various government departments and building strategic alliances with groups on common priorities, such as our Manitoba Public Health Association and our specialty groups or other sectors that are working on common issues. And then there's the higher profile activities that most people think of when you think of advocacy, the media releases and position statements and promotional campaigns. So I have another poll for you. So what advocacy issues would you consider to be important to address in Saskatchewan? Some of the options that you can choose from, and it's multiple choice, is chronic disease prevention and management, environment and climate change, harm reduction, healthcare system changes and impact on nurses, health equity gap, health promotion, Indigenous health, intersectoral collaboration, long-term cares and seniors health, mental health, public health capacity, recruitment and retention of nurses in Manitoba. Sorry, that would be in Saskatchewan. Safe quality practice environments, social determinants of health, social justice issues, substance misuse, and universal health care. I raise those as options in that that's what our members are telling us. And that's what our board is working on right now, is to look at those options and identify the priorities for us to work on. So what are the benefits of membership and what can an association do for you? Being part of a professional association offers you an environment of support, networking, professional development, and leadership opportunities. There are also opportunities for growth, both by volunteering to join the board or one of the committees or programs that you have. A very popular benefit that has nothing to do with nursing and everything to do with discounts on services and online shopping provides members the opportunity to recoup their fees quite easily. I often use my own example. I have grandchildren in Alberta, and I often like to go and visit on long weekends or whenever there's seat sales. And with our Percopolis benefit, we get 15% off of WestJet base fares. So it's very easy if you're using airlines and things like that to recoup your fees. Because as a voluntary organization, it is something that is dependent on member fees. Our professional development events and resources focus on a variety of trending topics. Right now, we are placing a lot of significant time and effort on resources and supports related to COVID-19. We feature a weekly Talk Tuesday, a virtual forum that brings nurses together to discuss pertinent topics of issues and concerns. And that is right now open to the general public and other nurses throughout Canada. So if you wanted to check it out, by all means, you'd be welcome to attend one of our Talk Tuesdays. We are very proud of our Emerging Leaders Network that was developed to offer a unique and safe environment for nursing students, new grads, and early career nurses where they can connect and support one another during critical times of transition. I think these testimonies submitted by some of our members really illustrate the value of membership to them. Some will say that ELN has made me feel more confident in my transition from student nurse to grad nurse. I think for me, the best part of ELN is meeting like-minded individuals who are early in their nursing careers and have a desire to support one another. Others go on to say, for me, the Emerging Leaders Network has been a dynamic and engaging group in a space where nurses support each other. And event after event, I am reminded of the numerous reasons for which I chose nursing. This group keeps me motivated and engaged in a continuously changing climate of the professional nursing world. So here's another poll, and this one is going to deal with the benefits of membership. So which of the following membership benefits would you value? And again, these are options that can apply to many of the programs that could be initiated with Percopolis. So some of them, for example, would be, do you value the most in a professional association advocacy for the nursing profession and healthy public policy? The CNA membership that we're bundled with, that most associations are promoting as well. CNA certification. As an association member, our nurses receive a significant discount on the CNA certification. The CNPS professional liability protection as a group discount that we provide is quite significant in comparison to the individual beneficiary rate. Being able to be part of a committee, our membership with CNA allows us the connection to the International Council of Nursing, the Emerging Leaders Network that I spoke of, leadership development, the networking opportunities, those Perk for Nurses programs. We have a monthly pre-authorized payment plan, which really has been wonderful for nurses because, you know, it gets to be that time of year during renewal is so dangerously close to Christmas that it's so hard. Whereas with a monthly payment plan, it's quite manageable. And nurses find like by the time renewal starts, it's already been saved up and they're ready to go. The professional nursing awards and recognition that I mentioned before as part of our focus. The scholarships that we have that are linked to the Canadian Nurses Foundation are a very popular benefit to the association. We provide significant specialty group support to assist them right now during COVID. Many of them were required to do AGMs, and because we had just finished our AGM, we had templates for the registration package and how to do a virtual AGM, how to email the registration for members. So it was very easy for specialty groups to take that material that we provided and revise it for their own. And many of them don't have the funds to have a Zoom account or secretarial supports and things like that. So those are ways that we can assist them because they are our members and we are here for members. And most importantly, again, during COVID, being able to provide virtual forums where nurses can come together to support each other. I love quotes, and I think this one is so very fitting for you right now. And I hope that Margaret Mead isn't listening because I'm going to make a slight revision. We can never doubt that a group of thoughtful, committed nurses can change the world. Indeed, it is the only thing that ever has. In order for an association to get established and then thrive, it needs commitment and support from all nurses in order to strengthen that collective voice of the professional nurse. An association can help you navigate the present and, most importantly, help shape the future of the nursing profession. So one last quick poll that I'd like to provide is I'd like to know if I was able to help you better understand the value of an association. So it's a quick and easy yes or no answer, or somewhat, which is very reasonable in that there's still lots to learn and lots to share. So I'd like to thank you for this opportunity, and we would be very happy to assist you in any way by giving us a call or an email, or I encourage you to go visit our website just to see what an association can provide to its members. So thank you, and enjoy the rest of the conference.
Hey everyone. Thank you so much, Mary, for that presentation. Lots to learn, lots to think about. I have so many notes that I made. I don't even know where to start. I think I'm supposed to share a learning or two, but I guess to me, what a couple things that really stuck out was just how nurses in Saskatchewan will need a very clear understanding of the roles of an association and a union and a regulator, and that really that understanding is so foundational to beginning the work of building a strong association. SRNA Council, of course, supports the building of a strong and vibrant association. We believe that it is an essential third pillar that can really strengthen nursing practice and the professional work of nurses in Saskatchewan. And I just wanted to also point out to Mary's point that it's grassroots leaders like nurses like you and me who are really so important to starting the work of an association, and that it takes commitment and time. And so we have to be patient with that process, and it can be a bit difficult. So I'm just very encouraged, though, to hear of Mary's historical view and being able to look back and share the successes and also the difficulties of building a strong association.
Tomorrow, we will dive into the last of the 3 dedicated sessions on each nursing pillar. We are pleased to welcome Deanna Williams of the Dundee Consulting Group to share with us the role of the regulator and hear her experience working with health regulation across Canada and around the world. We encourage you to tune in tomorrow at 12 o'clock to hear Deanna share.
And just to close off, a reminder that the recorded version of this session will be available for 30 days, starting now, to rewatch whenever you want. We invite you to, of course, email any additional questions or comments to conference2020@srna.org and join our Voices in Action Facebook group to continue the conversation there. We're so glad you joined us today. Thank you for making time for us in your busy schedule. It's a great privilege to be able to work with you and hopefully begin the start of building a very strong association. Thank you so much, and we'll see you all tomorrow.